It's 6:35, so I think we're going to get started. So I just want to start by saying, thank you everyone for joining us this evening for Health Advocacy Academy. My name is Matt Green. I'm the District Director for New York City Council Speaker Corey Johnson's district office. And we're really grateful to be hosting this event with some amazing organizations who will be providing information on how you can be a more empowered patient, or as some of you had mentioned in the comments already, how do you advocate on behalf of someone who needs help? So this evening, you will get information and tools to help you better understand and communicate your own health needs, how to make sense of your health insurance and benefits and bills, and so much more. So we're joined tonight by the Community Service Society of New York, which is an informed independent advocacy organization, and they work on behalf of more than 3 million low-income New Yorkers. Their mission is to help address the root causes of economic disparity through research, advocacy, litigation, and program models that strengthen and benefit all New Yorkers. We're also very happy to be joined by Say Ah, which is a community-based organization co-founded by Anna Allen, right here in Council District 3. Say educates, activates, and empowers people to maintain and manage their health, which we all know, especially right now during this public health crisis, can be very overwhelming and complex. And Say does this by providing skill building workshops like this event this evening, training professionals to better meet health communication needs of the people they serve. And they've been an amazing partner with our office over the last few years. And we really want to thank Anna and Say for organizing tonight's Health Academy. So with that, I will turn it over to Anna, who will introduce our presenters for this evening. And again, thank you all so much for joining us virtually. We hope we can all get together in person soon for future events and see you all again. It's been a while, but despite that, we hope you find tonight's event informative and helpful. So thanks everyone. Take it away, Anna.
Matt, thank you so much. And we're so grateful to you and to Speaker Corey Johnson, who's just been an amazing supporter of our work and healthcare consumers across the city. So things have changed a lot during his time in office and all for the better. So thank you so much. And thank everybody for coming and zooming on, logging on this very rainy night when you'd probably rather put on a movie, but we appreciate you being here with us. And we do want to tell you, we have a couple of housekeeping issues to start out with, because I think sometimes when you say Health Advocacy Academy, that covers a broad range of topics. And we want to be very clear about what we can and cannot do in a forum such as this one. So first of all, this event is really designed to give you some basic skills so you can tell your story in the healthcare system, and also when you're trying to make policy change, so you can advocate for yourself in the healthcare system while you're trying to manage your care, and so you can advocate with elected officials so you can make change to the system. So it's very skills oriented. We will have resources that we're going to drop into the chat as we go, and we will also have a handout that we can pass along at the end that will have a lot of what we talk about at this webinar. We're monitoring the chat, so if you have comments or questions, please put them in the chat. We're going to keep questions until the end. We're just going to stay focused on what we're trying to do. But if you have a issue around clarification, please definitely put that into the chat and we'll address it right away. And then other questions we'll wait till the end. And then finally, we cannot give out health or medical information, and we cannot lobby. So we're not going to tell you what to do about your health issue or your medical issue, and we're not going to promote legislation and try to push it forward in this forum, but we will talk about some legislation in the advocacy piece of this. So tonight we're going to do a little bit around introductions. Then Tomi Santan is going to talk about storytelling. I'll talk about health literacy. And then we'll have some empowerment and advocacy tips, which is really, I think, why you all came. And then we'll do a Q&A at the end. So I'm Anna Allen, as Matt Green graciously introduced me. I co-founded SEA. I come out of a writing background, and I met another writer, and the two of us were having such difficulty managing our health issues that we kept saying to each other, if we're having these kinds of problems, imagine people who really can't read the handouts, who can't um, understand the information they're getting, who can't do the research. What is it like for them? And so we, in researching this topic, because we're writers and researchers, we hit upon health literacy, and that was it for us. It just changed our lives. So SEA has been around since 2007, and in that time, most of our work has been in the community, and we've done a lot of workshops like this one for patients, caregivers, and community members, and we've done it through a whole range of the life cycle, from people who are parents at Head Start to people who are in hospice. Everybody really needs these basic skills to learn how to advocate for themselves wherever they are in their life and accessing care. And then we also, as Matt said, we train professionals and we partner with other community organizations to help make health information and services easier to access, understand, and use. And now I'm going to turn the floor over to Tomi Santan, my colleague, who's the narrative competency lead at SEA.
Hi, everyone. So great to have you here. As Anna just mentioned, my name is Tomi Santan, and I work for SEA as a narrative competency lead. I'll be running the storytelling portion of our workshop here today. So you might be already wondering, what is narrative competency? It's basically the ability to tell your story in a clinical health setting or before a legislator, empowering you with the tools you need to tell a concise and clear story of your experiences to access the resources you need or advocate for the changes you want to see. So I want to begin tonight's workshop with an example of a health story. Right here you see Catherine Schneider, who is a vision impaired woman who decided and was gracious enough to write down her health story and publish it so that we might all learn. She wrote, "Greet me and introduce yourself when I enter your area. It makes me feel a lot more reassured to know that you are Nancy, a med tech who is going to draw blood rather than just some wandering vampire. Saying hi when you're entering my room in a hospital, or if I approach your reception desk alerts me to the fact that someone is there. You know you're there, but I don't, unless you've had a lot of garlic for lunch. Read me instructions. If they're at all complicated, give me a braille or a tape recorded copy to take home, because I may not have someone at home to read printed instructions for me. Please give me instructions I can follow. Imagine the frustration I experience from the following directives. Take the pink pills twice a day and the blue ones 4 times a day. How am I supposed to know that? Cut small pills in half. Read the instructions above the toilet to prepare your urine sample. Awkward. When I arrive, have office staff offer to help me fill out patient information and consent forms in a private place, so I'm not shouting personal information in a crowded waiting room. Remember that when I'm on your turf, I'm out of my familiar territory. And if all else fails, ask, may I help? If I say yes, follow up with how, and together we'll figure it out. Catherine's story is just an example of one health story. And health stories matter because they give meaning to our experiences of illness or our experiences of health. They humanize and they create connection. They offer a deeper, enhanced understanding of the patient experience. They create an authentic connection between a patient and a provider. These stories also matter because they help set a patient-centered agenda. They help with diagnosis and also determine the course of a treatment plan. In a diagnostic encounter, these stories encourage empathy and promote understanding between a healthcare provider and a patient. And they even may be useful for analytical cues or categories to help with diagnosis. They're often memorable, they're grounded in experience, and they encourage reflection even amongst providers. These stories challenge perceived wisdom, they challenge assumptions, and they help create new knowledge. I want you to type in the chat, what types of things make you uncomfortable in a doctor's office? Just drop in a couple. I'm sure there are many. Let's take a moment to talk about how awkward it is to tell your doctor about your bowel movements. Let's not lie, it is. It definitely is. But why are we so nervous for the doctor to know? And it's becoming a big issue now, such a big issue that people are researching vulnerability because it is putting our lives at risk. But if I told you that the Joint Commission on Accreditation of Healthcare Organizations says that communication errors are 60 to 70% of preventable hospital deaths. I see you guys already putting in the chat, crowded waiting rooms, talking to my doctor about mental health is uncomfortable, not knowing if the doctor is really being honest, being in a foreign environment from usual. Doctors often look at computer screens rather than the people that they're talking to. Some can be condescending. There's so many different reasons why we're uncomfortable. And I put the statistic out here in big, bold letters because in the medical field, it pays no one of us to be shy. You have to be loud and repetitive and also clear and concise. The standard is high. The exam room is not just supposed to be a safe space, but it's also must be a brave space. It's a space that we should feel comfortable. We hope that you feel comfortable, but honestly, oftentimes we don't. It's a place where we need to push through the discomfort we feel to get the resources we need to be the healthiest versions of ourselves. I'm going to give you another example of a story where a patient had to advocate for yourself. But again, in the chat, I want to hear about what's the last movie or TV show that you watched about healthcare or the hospital? Do we have any Grey's Anatomy, private practice fans in the room? Who watches ER? Has anyone seen John Q? Put it in the chat. I want to hear what you guys are watching. And I'm going to use this moment to let you into my life a little bit, since I'm asking you all of these questions in the chat. When I'm not giving presentations like this, I do some qualitative research or conduct oral history projects. In plain terms, I listen to patients and providers and learn from their experiences in healthcare. I listen to find out what they think is wrong with healthcare and how we can fix it. And during one of these oral history projects, I had the opportunity to hear from Jessica. Jessica has sickle cell anemia. It's a blood disorder where your blood cells are misshapen. There's currently no cure. And one of the symptoms of sickle cell anemia is severe chronic pain, often called crises. Sometimes it gets so bad that Jessica has to go to the emergency room for pain management. When she enters the ER, she often asks for fluids and some sort of pain medication. And when the clinicians pull up her chart in the system and see that she's been there several times, they tag her as a frequent flyer. They assume that she's just seeking drugs and not actually in pain enough to warrant medication. It does not help that Jessica is also Black and also a woman. They don't often believe her. What they don't know about Jessica is that she is also a healthcare provider. She works in an ER across town as a physician's assistant. She knows what she's talking about. She knows her body and she knows what she needs. As a healthcare worker herself, Jessica acknowledged while she told me her story that people in the ER are often handling multiple cases at once and feel pressure to put out all the little fires everywhere. But she also said that the assumptions that other clinicians make about her pain are dangerous. She demands to be heard, but those who often feel ignored by the healthcare system, especially people like her with chronic pain, might go elsewhere to desperate measures to seek pain relief. While I was listening to Jessica's story, I remembered something said by a scholar named Keith Walu. He said people in pain often bear two burdens, the burden of physical pain, and then the burden of performing that pain enough to receive help. So many patients with symptoms like Jessica go unseen, unheard, and as a result, and I like to say unhealed. While healthcare providers have medical knowledge, we are the only experts of our bodies and our experience. We have to speak up and demand to be heard too. Our stories matter here and always. And to prove to you that stories don't just matter in the hospital or in front of a doctor, who remembers the Als Ice Bucket challenge that went viral during the summer of, I believe it was 2014? It was a campaign to raise money for amyotrophic lateral scoliosis, also known as Lou Gehrig's disease and more often known as ALS. The idea was you had to donate money to the ALS Association to help fund their research or dump a bucket of ice water on yourself. The campaign ended up raising more than $220 million and went viral on social media, which brought a lot of attention to the disease. But it all started with a golfer named Chris Kennedy, who wanted to bring attention to the disease because his friends, Anthony Sinertia and Peter Freitas, both had the disease. Anthony and Peter told their stories to Chris, and Chris told the world. By sharing their stories with their dear friend Chris, they were able to stir public support, which quickly turned into financial and political support. Funnily enough, none of us were there that day when Anthony and Peter told Chris their stories. What the exact words that moved Chris's heart, no one actually remembers. But it's like Maya Angelou said, people will forget what you said, people will forget what you did, but people will never forget how you made them feel. Chris didn't forget, and now we can't forget. These stories like these inspire people to make change. When I was talking to Anna earlier today about this presentation, she said something really important to me. She said, you know, Tomi, this presentation is really about connection, story, communication, and power. And I agree with her, it is. We're combining health literacy and civic literacy skills through the power of stories. Health literacy is the degree to which individuals find, understand, and use information to navigate the healthcare system. Civic literacy is the degree to which individuals can find, understand, and use information to make the changes they want to see in the world. We are trying to emphasize that your health story makes a difference in transforming your experience in healthcare and transforming the healthcare system in general. Stories affect every level of policy development. The stories that politicians hear determine how they set their agendas for the year. It impacts what issues they choose to tackle. These stories play a part in forming the language of the policy itself and its adoption into law. Stories influence how these policies work on the ground with community-based organizations or with the local Department of Health. And of course, stories are often how people learn if the policies are working or if they're not. So now that I've convinced you that your health story matters, or I hope I have, you're probably wondering, how do I tell this story? Well, I want you to begin by being honest. I want you to tell an honest story and admit that you might not be okay. I'm going to tell you how to develop your story by asking yourself questions, and I encourage you to become a master storyteller and learn to break through the discomfort we all have about telling stories about ourselves. So 1, say I'm not okay. First things first, I definitely want to emphasize that it is okay not to be okay. Whenever someone speaks, whenever someone asks, how are you? We automatically reply that we are fine. Even during this whole pandemic, we've said we're fine, we're fine. We lie automatically. We are conditioned to lie. In order to tell a good healthcare story, a good health story, you have to be honest and be complete. It's not easy, it's uncomfortable. We have to go out of our way to be honest. I want you to push through the discomfort. Your health story doesn't have to sound pretty. It doesn't have to be perfect. You don't have to tell the dentist that you floss twice a day, or you don't have to tell your doctor that you eat a salad every night if it's not true. Tell your doctor that you had 4 donuts and 2 cups of coffee. And trust me, you will get a lot further through honesty than by lying. Next, I want you to frame your story around 5 W's and an H. So the who, what, where, when, why, and the how. Let's say you had a bad fall the week before you saw your doctor. You want to ask, who do you live with? Or who saw your fall? What happened? Where were you during this time? When did it occur? Why do you think this happened? Or why are you here today? How did it happen? These questions are holistic. They are a tool to make sure you've got your basics covered. These questions will often lead you to the most important parts of your story, but this is really what you want to cover. Previous or current diagnoses, complications that you might be having with your health, current health behaviors like how often you exercise or what you eat or how much you sleep. You want to tell them about your mood, your general state of well-being, like if you've been extra anxious or if you've been extra sad during this time of isolation and quarantine. And then you also want to prepare questions for your provider. And the next thing I want you to do may sound a little bit weird, but I want you to answer questions with stories instead of yes or no. Oftentimes there's this silent belief that the doctors don't have time to spend with us. So we feel pressure to rush ourselves and make ourselves small so we don't bother our healthcare providers. I want you to take that idea and throw it out the window and take up space in that patient room. When they ask you if you get constipated often, I want you to tell your doctor about the fabulous double chocolate cake that your daughter made for you for your birthday, and that unfortunately, it gave you the runs. When they ask you if you get headaches sometimes, I want you to tell them about the neighbor who plays piano badly and loudly, unfortunately, next door. Tell them everything. This does two things. It helps you foster a better relationship and a more honest relationship with your provider. And it gives you a chance to repeat details of your story and introduce anything that you might have accidentally left out. Get into the habit of sharing about yourself. This can be a little hard, so I'm going to give you some homework. Tell someone you trust about your last experience with the healthcare system. And when you're done, ask the person you told to tell you what they heard. We ask that you do this because sometimes there's a gap between what people said and what people hear. The way you tell the story might not be the way that it is understood. Lastly, after you do this exercise with someone you trust, go through a couple of these questions. How did it feel to tell your story? What did you hear in your partner's story? How did it feel to hear your partner describe your story? How would you change your story if given another opportunity to complete this exercise? Going through this practice will help you tell your health story, and who knows, that story might just save your life. And next, I'm going to pass it back over to Anna Allen, our executive director here at SEA, who's going to do a deeper dive into health literacy.
Anna, you're on mute.
Oh my God, that was like my best work. I was saying that one of the things that we were considering and thinking about when we were developing this webinar was, how are ways we can build power. There's a lot of talk about patient empowerment, consumer empowerment. And I think people don't really have a good idea of what that means, but stories are an incredible way to actually be a powerful person. So that's why we begin with that, and we will return to it again. So Tommy, thank you so much. That was awesome. All right, now for the big come down. I'm going to talk a little bit about health literacy, and then we're going to get into some very granular tips on things you can do when you're navigating the healthcare system to get safe, effective care. So, so first, I'm just going to talk about health literacy. Tommy did define it as ability to find, understand, and use health information and services. Basically, health literacy is another way of just drilling down on this, is how we understand that information, how we apply it to our lives, and how we use it to make decisions. And I think the pandemic was such a moment for all of us to stop and work on our health literacy. Whether or not you went to the grocery store, whether or not you visited somebody, whether or not you left your apartment, got in the elevator, whatever it was you were doing, whether or not you went to an ER, all these decisions were actually took health literacy skills. You were taking the information that you knew, you were thinking about it, and then you were applying to the best of your abilities it to your life to make positive, healthy choices, hopefully positive, healthy choices. Health literacy, with all the social determinants of health that we have out there, housing, age, income, race, employment status, education level, health literacy actually supersedes all of them. And it supersedes all of these social determinants of health. That is 7 p.m. in my building. They still cheer. I don't know if you can hear. But health literacy supersedes all these other social determinants of health because our healthcare system has become so complex that being able to navigate it is a key predictor of whether or not you're going to be healthy. It's also a key predictor of how well you can care for yourself and manage your health. So not only is our system complex, but the burden of care has shifted from your provider to you. We used to go into the hospital and have surgery and stay there for long periods of time. A lot of stuff now is outpatient. More stuff is happening in the home. We have take-home chemotherapy. A lot of stuff is in our hands or the hands of our caregivers. So an example of this is my mother went in to have brain surgery. She went in Wednesday morning. She was in surgery for about 8 hours. She was in a ICU following the surgery for 24 hours. Then she was in a regular hospital bed, and then they discharged her to our house. So you can imagine what we had to take on as a family to support her care 48 hours after brain surgery. It's a lot. So because our healthcare system has become so complex and we have to manage very complex health situations, about half of the population really can't do this. It's not that they can't do it well, it's that we're really functionally illiterate in the face of our healthcare system. And I would actually put myself in that category before I started working at SEA. And now actually I've crossed over to the top half, but it's very difficult. The other thing to think about with your health literacy is that even people who are providers, even people who are medical doctors, when they're faced with a situation that's challenging and unknown to them, they themselves have difficulty navigating the healthcare system. And some of the most critical things you'll hear of the system are people who have worked in it for many years and then actually have to enter it as a patient. So, part of this patient empowerment piece is going to be to give you some just basic tips, things you can do to make sure that you're going to be a safe, effective advocate for yourself to get safe and effective care. And I'll go over. We're going to talk about setting goals, being informed, being prepared, how to give good information, how to get good information, how to know that you understand what's happening, and then finally, how to navigate the all-important power dynamic. So in terms of setting your own goals, this is really how our healthcare system hopefully will be moving, that when you get to your provider, they will ask you, what is your goal? Not what is wrong with you necessarily, but what is your goal? Because again, we are responsible for managing so much of our healthcare and making so many of our own choices. We at SEA always think you should set your own goals because only you know what you want. And if you don't know what you want, or you don't communicate what you want to your healthcare provider, they will choose as they think you want, as they assume you want, or maybe as they might wish for you, which is not always how they would wish for themselves. It also makes every subsequent decision easier. When you've set your goal, it's much easier to figure out how to get there and to make decisions about what care to get, what care not to get once you have that goal. And it will help you overcome a lot of barriers in the healthcare system. Ways to set goals. You really want to set a specific goal. And what you want to do is really think about what matters to you. So in some cases, it'll be fitting into a dress that you used to wear, but after your COVID 15 or 20, you can't fit into anymore. So it may be that, or it may be that you're facing an end of life situation and you just want to have quality time with the people you love. The goals run the gamut. They can be something very short term and important at the time, or they can be very, sort of timeless. But you want to figure out what matters to you and think about specifically what that is. You want it to be measurable when it can be measured. So you know, when you set your goal, I want to fit into this dress, I need to lose 10 pounds, I have this much time to do it. You want to be able to measure what that is. You want to make it achievable. So if you want to lose 10 pounds between now and May, you may want to say, okay, I want to break this up and you know, I want to lose 2 pounds a week. Or, you know, if your goal is to just have quality time with your friends and family, you know, before the end, you can say, you know, I want to be able to sit up in a chair and share a meal with my family. I want to make it through Passover. I want to make it through Easter. I may want to make it to a birthday. You know, and those are things that you can really set. You want to make it relevant. You want to know the purpose of your goal, and you want to make it time bound. Again, when you can. Not all goals are going to be time bound, but you know, if it's, you want to be able to say this is when it's going to end, or I'm going to do it for this period of time. It's just a good way to help you keep measuring it and referring back to it, seeing if you're on track. So it's important to set goals. More on that. We're going to give you information on that in the chat. The second thing is you want to be informed. Information is power, but really it's good information is power. There's so much bad information out there. People cannot distinguish. Your healthcare provider oftentimes cannot distinguish between good and bad information. We as patients and consumers have a tremendously difficult time also distinguishing good and bad information. If you're going to do online research, which I think most of us are probably doing, use medlineplus.gov as your main portal into health information. This is a great site. We pay for it through our taxes. It's a walled off site of credible information. Everything is research-based and reliable. When you Google something, there's paid ads. You know, there's ways that things will crop up on your screen. You know, if you're searching something else will related to that will pop up while you're doing your research. That's very distracting. When that happens, you can misread something. You're going to get tired just getting through the pages of what they throw up at, you know, in the top 5 search results, because usually those are paid results. By the time you get through those, you're tired, and then, you know, it could really be the time when you're getting information that's credible. So do not Google, just use Medline Plus. This is an example. And then when you are just wandering the web looking for health information, or, you know, getting pamphlets, there's a test. I don't know if you're aware of it. It's the CRAP test. Is it CRAP? And this test is a great way to see if the information is reliable or not. So you want to see if it's recent information or if it's outdated. So is it current or outdated? Is it reliable? Is it an opinion piece? Does it name sources? Does it have facts? Are the facts, are they cited from another source? You really want to have some skepticism as you're going through it to see if the way it's written and what it includes is reliable. You want to figure out who the author is or the authority who produced the piece. You know, if it's a for-profit company and they're trying to sell you something, or they have tried to sell you something in the past, or they sell something related to what you're researching, that should definitely make you think it could be crap. And then also, what is the point of view or the purpose of the piece? So, you know, it may actually just be a straight sales pitch. There's a lot of advertorial out there that's masquerading as health information. So you really want to be a skeptic when you're looking at stuff. We also think it's very important, again, building on Tomi's storytelling, to connect with people. People have a lot of information that you can use. So find a care provider you can speak with. If you don't feel like you can speak with your doctor, you need a new doctor. If you don't feel like you can speak with your nurse practitioner, you need a new nurse practitioner. You want to join groups. A lot of people in groups have great information about how to manage your health or your health condition that you won't find anywhere else. So Facebook has groups. There's groups that meet online. There's groups that meet offline. There's a lot of patient portals now that patient sites that have subgroups that are formed around diseases and health conditions. Seek them out. Finally, stay in touch with your elected officials. A lot of what happens with your healthcare is actually just regulatory. Your insurance may be paying for something or not paying for something. They will have information on that. So stay, if you're not on Speaker Corey Johnson's newsletter list, get on it. And then just, when you're doing your research, just make sure that you have time and that you're giving yourself a chance to understand what it is that you're learning. The third tip for you is to be prepared and to go into any healthcare encounter prepared with accurate information about yourself. I think one of the things that we think happens, this is a huge myth around healthcare, is that our health and medical records are accurate, which we know that they're not, and that health systems accurately exchange information about us, which they do not. Many times systems do not even speak to each other, and when they do, they often have incomplete or erroneous information about us. So it's very important to stay on top of your health records and also to have them available just in case there's an emergency, or you need them for some reason. So the two key pieces of information that you want to communicate and have on you and also have accurately in your health record. The first is a medication list about medication misadventures land about 2 million people in the hospital every year. So medications are a huge problem. So you want to make sure that your medication list is accurate and up to date, and that it includes not just your prescription medications, but also your over-the-counter medication. So if you're taking Tylenol PM or you're taking allergy medicine, you want to include that on your medication list. Herbs, vitamins, and supplements also should be included. They have real impacts on your body and can interact with your prescription medications or foods you're eating or your over-the-counter medications to produce negative impacts on your health that can land you in the hospital. So as Tommy was talking about telling your story, if you say, oh, I took my supplements of whatever, and then I was really tired and I tripped and that's how I broke my arm, that's an important story for a healthcare provider to hear. All those details are important. So on this medication list, you want to have what you're taking, how much you're taking, how often you take it. And if you don't take it regularly, just say as needed, when you take it. If you take it in the morning, you take it at night, why you're taking it. We take a lot of medications, not for the reasons we're supposed to, but either they're prescribed for us for a different reason or we take them for a different reason. Your doctor's contact number, and then any notes you have on about the medications. The second document you need is a health summary or personal health record. And this is a really important document, especially since our health records are wrong so often. And it should have your name, your date of birth, and then the date that you've created this. You need the actual date you've created this on there as well. It should have your health status, list your medications, put your medication list with it. Anything that's going to impact your care. If you have allergies to medications, if you have reactions to something, that needs to be upfront, especially in case of an emergency. You want to have all your contacts there, your providers, your pharmacy, your healthcare proxy, the date of your most recent physical tests and screenings, any major health events and the dates that those occurred, allergies, and then also what runs in your family. So you can be in a situation, you can be in an emergency situation where this needs to get to a provider immediately. And you can't, again, rely on those health records making the transfer. Also, your health records probably, if you're older, are not going to be complete in the system. And this document can help remind you of things that are happening that sometimes you leave off. Again, as Tommy said, sometimes we get to the healthcare encounter, we're like, I'm fine, but we're not fine. And that will be on your health summary. And then the third document that's key is your healthcare proxy. We do a lot of work around healthcare proxies. I think people don't like to fill them out because they think of them as end of life, who's going to pull the plug, but that's the wrong way to frame it from a health literacy perspective. This is a really key document. You want to make sure that, that you have named a healthcare proxy who can help you just when you cannot speak for yourself in a health or medical situation. So when you can't advocate for yourself, if you don't feel well enough, if you don't feel together enough, this is when your healthcare proxy can step in. It does not have to be an end of life situation. For many of us in New York City, we're not married, we don't have family around us, and the healthcare system is not going to give information to people who may just be somebody who's close to us, or could be a partner that we just didn't marry. The healthcare system is not generous about handing out health information because of HIPAA, and they won't give out this information to other people. So if that person is named as your healthcare proxy, it takes away a whole field of end runs about trying to get information to somebody who's supporting you as a caregiver, or that you're supporting, if you're somebody else's caregiver. You don't need a lawyer to do this. You just need two people to witness it. And then you want to educate whoever that advocate is that you name. You want to make sure they have your medication list and your personal health record. They are only really as good as the information you give them. And so you want to give good information, including those documents. And then you want to apply what Tomi said. You want to have a complete health story. You want to be honest. You want to communicate things you want and who you are. And then you also want to get good information when you're, whether you're getting from your healthcare provider or whomever you're working with. When you go to see the doctor, you want to write your questions ahead of time and lead with them. And this is actually even true in emergency situations. Most of the times we end up in the ER, we are fully cognitively intact. The vast majority of us go to the ER under those circumstances. And even then we want to have our questions. And we want to say, we have questions. When can I get my questions answered? You want to speak up when you don't understand something. Your care provider is going to think that you do understand and you're not paying attention, or you don't care if you mismanage something on your end. So when you don't understand something, speak up. You did not go to medical school, or maybe you did, but you don't understand what your provider is saying. Speak up and say, I don't understand. Can you say it again? I don't understand. Can you say it again? One more time, until you get it. This exchange of information is really one of the most important things that comes out of a healthcare encounter. Take notes. Alternatively, or in addition, you can bring someone with you, have that person take notes, or you can put somebody on the phone. You can also ask your doctor if you can record a conversation. Oops. When you get the information that you need, you want to check at the time you're in the doctor's office or in the healthcare encounter that you understand it. So before you leave, this is when you want to use a technique called the teach back method. And the teach back method is essentially you put in your own words the information that was given to you, and you explain it back to your provider. And you say, if they say, take this medication in the morning, you want to say, let me make sure I have this right. Starting today, I take these 2 pills at dinner, then I take 2 pills at breakfast, and then again at dinner until the prescription runs out. Whatever the instructions are, you want to teach them back to make sure you understand them. Once you leave the doctor's office, once you leave the hospital, once you leave the urgent care and you get back home and you're trying to figure out what's going on, that is a terrible time to be able to get back in touch with your provider. Your provider has left, is busy, may not even actually accurately remember what she or he told you. So you really want to make a mental note to always check you understand. And then finally, I think one of the hardest things that we all face in our advocacy, our self-advocacy in getting the care we need, is just navigating the power dynamic. And there really is a power dynamic. I think people in the healthcare system don't realize how much more power they have and how much more information they have than your average person. So being able to navigate that to get our needs met when we're in a hospital. Sometimes you're just thirsty and you want to drink. Sometimes these are very basic things that are going on. You really have to navigate that power dynamic. So a couple of things you can do to do this, to increase your power, is you want to look powerful. If you are informed and prepared, you will look powerful to your healthcare team. They will appreciate the fact that you are on top of your healthcare and that you've thought of questions ahead of time. That does not go unnoticed. That's very important. Second, our healthcare providers right now and in general are incredibly stressed. You want to be nice, but you want to be firm. You want what you want, you need to get it. Be nice, but be firm. Keep keep that mantra. You want to advocate for your goals. My goal is this. How do I get that? My goal is to feel better. Can I have a glass of water? That will help me feel better. Like, you want to keep advocating for your goals and using your goals as your end point, because that actually builds a team and a connection with your care providers. If you just say, I want this, sometimes people feel like they're in a zero-sum game. If they give you something, they're getting something taken away, even though it's healthcare. It's a psychological thing. So advocate for your goals and build that team. And then finally, there's strength in numbers. And so people will say, who work in hospitals, that the person who shows up with many visitors and a lot of attention and a lot of people there, they will get more attention from the healthcare providers. They know people are watching them, so you will get more attention from the staff. So always bring people with you. And if you're having to rethink who are your support people, because I think after COVID, so much of our community has dispersed. There's a great tool that will also drop in the chat, which can help you make a little map of your caring community. So who are you caring for? Who's caring for you? And these are people that you can start to identify and bring with you on your visits. So any questions on that? It's a lot. All right, Emily, it's on you.
Hi all, one sec while I transfer to the right thing. Okay. Can everyone see my screen okay? Okay, great. Okay, so I want to introduce myself. My name is Emily Doré. I work at the Community Service Society of New York, and I run our We the Patients program, which is focused on healthcare advocacy. So to take a couple steps back first, the Community Service Society of New York is a 175-year-old organization that focuses on anti-poverty, touching on all aspects of people's lives in New York, whether it be transportation, incarceration, student debt, or healthcare. And so most of my colleagues actually are lawyers or navigators, and they're helping people utilize the system around them. And so one thing I'm going to have dropped into the chat is if anyone needs immediate help with their healthcare insurance, or have a question about their healthcare, just need some free legal help, you can access our Community Health Advocates program. And actually, I even see one of our CSS colleagues, Ayaz, is here, so he might want to add something into the chat. But if anyone needs immediate help right away, well, Anna and I can't provide that kind of advice, please contact them. And second of all, at We the Patients, a lot of the work that I do is really uplifting consumers' voices to help advocate for healthcare reform change. And so that means, what that means without going into lobbying, without saying, I support this bill, it's really using people's voices to say, this was my experience and this is the change I want to see. And so that's kind of going to be the guiding force of today's presentation. And here's just my contact information. And then we are a very digital platform, so please follow us on all of these social media channels. And one other thing I wanted to add in as a resource is we have monthly social media working group trainings, and they're a really good space to kind of join in. It's a lot of different advocates. There's direct service providers, there's regular day consumers that have no affiliation with healthcare that all come to these meetings once a month to kind of learn how to advocate better online. So if that's something you're interested in, please feel free to drop me an email or drop your email in the chat and we can gather that. So this is a session schedule. So first I'm going to start with a patient story. And then we're going to move on from stories to political action and use kind of a legislative case study to show how stories are incredibly impactful. Everything Tommy taught you is important. And it really makes a difference in changing how laws work at the city, state, and even national level. And then Advocacy 101. We're going to just talk about some basic tools you can use to create political change. And as Anna mentioned, I'm not lobbying for any sort of bills or elected officials right now, but what I am doing is giving you the tools to make your own decisions about the healthcare you want, or really these skills can be utilized in any kind of social justice reform you want to see. So first, I'm going to start with John. One moment, I'm going to play his video. So if you don't have your sound up high enough, just turn it up, and it's just a couple minute long video.
My name is John W. Ingram. I never expect the last 2 or 3 years of my life to be like this, okay? But it has turned into an absolute complete nightmare.
So we have here bills from the New
Yeah.
York Presbyterian
Well, but no.
facility only.
Facility.
And for the same visit, we have the physician bills. We have the imaging services bills, which also came separately. And then here we have collection notices. So this is all from one visit.
Multiple bills, multiple doctors, multiple hospitals. They keep pouring in and pouring in and pouring in. Where do you start? Where do you end? You know, it's very difficult, very difficult.
So I want to share John's story with you. So as you can see there, John was a 75-year-old man. He was a cancer patient. He had had multiple problems related to his heart. He had Charcot foot, which made it almost impossible for him to really move around. He lived in a walk-up. It made it very, very difficult for him to get up and down the stairs. His immobility due to his foot condition made it so that way he had to regularly take ambulances to get to the hospital because he could not afford to take a taxi, but did not have the mobility to be riding on mass transit. He was retired on Medicare Part A. As you see there in that video, he had stacks of separate bills, from doctors, from radiology, from the ER, et cetera. And what you don't see here is that the reason why John came to us is because he was facing medical debt. All of these bills came in, recently his partner had passed away from complications of HIV, and that was his main support system. Now all of these papers are coming in. He doesn't know which bills have been paid. He doesn't know whether he has to pay this bill. And all at the same time, he's getting pursued by debt collectors saying, you haven't paid all these bills, while he's still continuing to have ongoing conditions. And he was also facing eviction from his landlord because he was falling behind in rent. And he had lived in this building for decades. And unfortunately, while we were, working with John, he ended up passing away. But I wanted to share his story because his story is just one of many that we heard where people were getting too many bills. They couldn't understand the bills that were coming to them, or, they were coming to us because they were being put into debt due to the high price of healthcare. So, and I'm just going to run through a couple of these, but I just wanted to provide a little bit of example. So we created something called the Patient Medical Debt Protection Act with Assemblymember Gottfried and Sandra Rivera. This bill is a 7-part bill, and a lot of it's very wonky and very high end, just talking about very small changes inside our healthcare system. But one thing that you'll see here, the very first issue, is hospitals send patients unnecessary and confusing duplicative bills. That was specifically, coming from John. We saw John, we said, that's a story that's important. That's a story that'll resonate with legislators. That's a story we're hearing from, patient after patient after patient. And so why don't we tell them that we think that there should be a better solution? So our proposed solution was, we create one itemized bill written in plain language delivered within 7 days after a hospital visit. Our logic being, you don't go to a restaurant and get a bill for every single thing that happens while you're there. You get one itemized bill, and is it really that hard for a hospital to do the same thing? Another person came to us with 27 different bills just from going in with kidney stones. That's just too much for any person to handle, even if you are healthy. And there's there's a lot of other aspects and trends that we've seen. CSS has served over 1 million clients. And with that, you can kind of start to see that patients aren't just randomly having issues with the healthcare system. There's trends, why are nonprofit hospitals suing patients for outstanding medical bills? It's putting people into debt for small sums of money. Lots of people are caught up in surprise bills. There's not a uniform financial aid form. So if you're somebody that needs financial aid assistance, when you go to one hospital, it might be completely different from another one, making it difficult for you to understand, how to fill it out if you filled it out already, and therefore you might not get the aid that you deserve. And so I wanted to show kind of how this one story inspired a entire piece of legislature that has moved through the legislature here in New York State and gained traction and excitement with consumers and legislators alike, because it's really defining consumer stories and issues within the healthcare system. And I just want to show a few more examples of kind of how and why your story is important. As Tomi and Anna spoke about, it's so important to tell the right story when you are speaking with your doctor or your care provider or even your caregiver, because you need to make sure that your health needs are being met right now and accurately. But when you're working to change the system, so the healthcare system within New York State, it's really important to be able to utilize your story to talk with people. There's still the same kind of ideas apply. Strength in numbers. Are there other people suffering with the same issues that you are? Are there people that have the same conditions that you have that are struggling? One example of this that we saw is after people kind of kept coming to us and saying, I've been sued over a hospital bill, I've been sued over a hospital bill. We started looking and realizing that, there was hotbeds across New York State of all of these different hospitals that were suing their patients when they're charity hospitals. And that's something that you might think, oh, I just have to pay this, or, oh, I don't know how to pay this, so I'm just gonna put this in a drawer. But when you start looking around, you might realize, oh, my cousin actually also got sued, or I actually just spoke with a woman who had been sued multiple times by one hospital over the course of a few years. So it's really important to kind of advocate and talk about the issues that you're finding difficult within just accessing the healthcare system and utilizing it, because you're probably not alone. And I wanted to show one more example before we get into our advocacy tools of a patient who really made changes. So I want to introduce you to Claudia Canafo, and I'll play you a video in a moment. But she needed immediate spinal surgery, and if she chose to not have the surgery, it could threaten her ability to continue her career as a concert pianist. Claudia is a very informed person. She's very outspoken. She's well-researched, very smart. She did all of her research, set a date for the surgery with an in-network surgeon. After the surgery, Claudia received a $66,000 bill from her insurance company, and then a $35,000 bill from her doctor. And it turns out that the provider directory that claimed her doctor was covered by her insurance was inaccurate. On the hook for over $100,000, she started telling her story to anyone who would listen. And legislators heard her. She would go up to Albany. She would call anybody that would hear her, reporters, anything. And in 2015, New York enacted one of the strongest surprise billing laws in the country. And that's just one example of one patient who really made their business that saying, I don't want this to happen to anyone else. And I'm going to play her experience.
Spinal surgery for anyone is terrifying. I think when it's your career, it's even that much more terrifying. And the day that I found out that I needed cervical spine surgery, everything just turned 180 for me as a mother, as a person, and as a concert pianist, because I didn't really know what the outcome was going to be. I knew that I was given something like 2 weeks to have the surgery done. It was that dire. And I went with this particular surgeon in Manhattan because A, he was highly recommended. And secondly, he took my insurance. And it even shows his name with my insurance listed on the hospital's website. They took the picture of it, and that was that. He never discussed financially what the surgery would cost. Never told me. All I heard is, I need this surgery. It's pretty much life and death. But he never said $101,000. And he never said, oh, by the way, I don't accept your healthcare. I started getting bills in the mailbox a few weeks later after the surgery. And that really was the moment that our lives, my family's life, completely changed, and really forever. Never been the same ever since I opened that mailbox to find my explanation of benefits. How did I get myself into this crazy situation where I have a doctor out of network and a bill for $101,000 and no means to pay that? Okay, my husband and I are going to get divorced. We're going to protect our assets. The doctor didn't know or pretended not to know that he was in network. The insurance company had no idea how they were going to refund me. I was a pawn in a system that is so broken. I lost my life. I lost my daily life. Patients should not be in a stretcher going into surgery saying, okay, let's see, I checked the surgeon. Did I check the nursing staff? Did I check the hospital? Did I check the anesthesiologist? Did I check, God forbid, something goes wrong? You know, they'll have to bring in this specialist. This is what a patient has to do now. This is wrong. And to put a patient in the middle of this system that's in place is about the most egregious thing I've ever encountered in my life.
So, you know, as you can see here, Claudia does a really good job kind of explaining her frustrations with the system. She's clear about, you know, her condition, what it was. But she then said, you know, like, there's things with the system that I find wrong. And before this, you know, she never advocated. So it really just kind of takes honing your story and working on it with some of those skills that Tommy and Anna had talked about before. You know, the more you say, the more you take up space, you know, the more impact that you're going to make. So now I want to switch over to some Advocacy 101. So one of the first things that you need to know before you can start really advocating for yourself is who represents you. So for each of us, we each have an assembly member. I put an example here of an old address that I lived at. And then it pops up with my assembly number. And then I'll quickly show you, you know, what does that look like? So, as I spell my address wrong, my old address. So I won't do this on both, but I wanted to show you at least one. So my assembly member pops up. It shows me the geographical area where she lives. And also in the chat, you can see here, if you want to copy down this web address and see who your assembly member is, if you do not know. This is where you would find it. Let's click on her page and see what there is that we can learn. Here's a biography, or we can just kind of learn a little bit about who is she. Right up at the top, a place to contact where you can email. There's generally the numbers for their Albany office as well as their local office, which is in the neighborhood where they govern. newsroom, any of the recent publications they've been a part of or press releases, so you can kind of know what's current. In the media, legislation that's important to them that they're working on. Committee membership, that's a really important one to know, because if your assembly member is on certain committees, it might make them, really, it's indicating that they're very passionate about certain things. For example, this assembly member is on the committee on aging. So if you had an issue that was related to aging or care of seniors, that this is a special area of interest where you could really, speak to this assembly member and write to them. I see you're a member of the Committee of Aging. I have these concerns and issues. The same goes for your senator. So these are the two people that you need to know, your assembly member and your senator, because these are the two people that, govern over your neighborhood, and you elected them. And so it's kind of their job to listen to you. And so often with our elected officials, they're very, very, very busy. And a lot of times they're up in Albany, especially right now, and we're going to get into that in a moment, but they don't always know what's happening in their neighborhood, and they don't always know the concerns of their citizens. So it's really important for you to let them know this issue is important to me. So for our senator here, newly elected Jabari Brisbois is my senator, and even just on the page, you can say message my senator. And it has the same things the assembly site had, where you can kind of figure out what committees he's a part of, what's been happening in the news around him, who is he as a person. And so with that, it's also important to understand some basic knowledge about the legislative cycle. So the biggest thing to understand why we decided to do these trainings right now is because this is kind of known as budget season. And not everyone, and I'm not an expert myself, so, listen, but know that you don't have to know every in and out of the budget or exactly how your assembly member does their job in order to converse with them. They're very nice, they're gonna be listening. But the budget, I would think of it as the governor's budget as one big bill, and then comes as many individual bills with a price tag tied to their passage, and kind of hence the budget, right? There's so it's like a bunch of different bills packaged all up in one. And what does it do? It usually covers big changes. So for example, there could be changes to our healthcare system, expanding coverage to immigrants. Lots of people know about single payer healthcare system. That would be something that will go into a budget. And how does it work? It's good. This is important to know because it starts out early in the year, and then it runs through April. So first, kind of at the beginning of the year, advocates and consumers, everyday people are going to work with the government to make changes. So this is a really important time if you want to kind of organize, or if you just want to express your concerns to your elected official, to start doing it. Next, after consumers and advocates say their piece, the Senate and the Assembly will make their own versions of the budget. Then in April, a final version will be passed into law. And when I make a slight side note that while in the summer it's a quieter time for the legislature, again, when we go back in the fall, this is a time where legislators are back. They're not working on the budget. When the budget is in session and they're trying to pass it and work on all these things with the governor, it's a very hectic time. And so sometimes you might get more success trying to talk to your legislator when they're not working in this, like between January and April, when they're working on this big budget. They'll have less pressing concerns. But to note that if you want to pass something with a price tag attached, it needs to go into the governor's budget. It can sound complicated, but basically you can contact your legislator anytime. And one thing a trick of the trade that you should know is that anytime you email them, call them, whatever, and talk about an issue, their staff has to write down that issue. And there's basically a tallying system saying, 20 people called about this light being out on their street. And these things have to be reviewed by the legislator. So it's so important to kind of take action, even if it feels like, you know, you're just telling a staffer or you're just sending an email, it is counted, it is noticed, and it has to be reviewed. And so, you know, there's again, strength in numbers. Ask your friends to call if there's an issue that you're passionate about. And I'll just be quick about this is, you know, there's a couple people that are really in power within the budget. In the Senate, that's Andrea Stewart-Cousins, the governor that many of us know, Andrew Cuomo, and then in the Assembly, that's Carl Hastie. So Andrea Stewart-Cousins and Carl Hastie are two people that you should know as well, beyond your own legislators. They're people that make big decisions and yield a lot of power in each of the respected houses. So if you ever want to reach out to someone beyond your own elected official, these are two people to know. And then I have one more story for you, but then a couple more tips. I wanted to share Maya's story because I thought she did a really good job of advocating for change while telling the importance of her own healthcare story, really combining the tools and skills Anna and Tommy taught you with what I'm asking you to learn now.
5 years ago, I was still on track to pursue a career as a professional dancer. In that time, my asthma has become increasingly severe, and it's become clear that that's no longer possible. Just since January, I've had over 6 hospital stays, and I've collected bills for each of them. I want to be clear, by the standards that govern this country's health insurance system, I have good insurance, but between multiple visits to specialists, lengthy hospital stays, and medications and other health-related expenses, I racked up so many bills that I've lost track. Just last week, I got a bill from a collections agency for $2,000 that I didn't even know I owed. It's practically a full-time job just to keep track of these bills because the hospital system doesn't do a good job of keeping them all in one place. It's already a full-time job to be sick, and I shouldn't have to contend with having to figure out how much money I owe so that I can be sick. I also contracted COVID in April, and while my case compared to so many, unfortunately, was relatively mild, I still had to be in the hospital for over a week on oxygen. And even months later, I still feel like I'm recovering. And frankly, I'm concerned about my abilities to work in the future. I need the New York Health Act as a person with chronic illness so that I can afford to be sick. I need it as a safety net. I'm 24 years old and I'm in so much debt that I don't even know the full number. I shouldn't be starting out my adult life in the red just for being sick.
So thank you for listening to Maya's story as I try to get out of, as I try to get out of the full screen. Sorry, all technical difficulty. Okay, I got it. So what I really love about Anna, or not about Anna, about Maya's story is that she explains several things. You know, she has a chronic condition. She is unfortunately impacted by COVID-19. Her ambitions and hopes for her future are, you know, kind of hurt and penalized from being sick. She's in debt, it's overwhelming. She has too many bills. The system isn't working for her. And then she proposes a solution. And it's not a solution I'm endorsing in any way, but it's a solution that she feels is right for her. And this is a very effective video. It's one that if you told your story like this to a legislator, it's making a very clear case for why, you know, this change is important to you.
5 years ago,
and I'm gonna replay her video, and we're almost done. And so one thing I want to add in here is I know we're in the era of a lot of us working from home if we're lucky enough, and many of us are under tight restrictions until we get our vaccines, and even after we get our vaccines, to be doing all of our advocating online. And so using social media, using digital tools has been really a strength for our organization during the pandemic. And it's a space where, as a consumer, you can really take charge of your health and also of the healthcare you want to see. So, on social media, Twitter is a great space where most legislators they really, really pay attention, especially if you're saying, hey, I want this, or hey, I don't like that. They're going to take notice, especially if you can get others to join in with you. One way to, as we saw in a couple of examples here, is visuals tell a very strong story. Videos are important. One way that we crowdsource some of these stories that we shared with you today was just posting on our Instagram and saying, hey, have you had experience and for this example, as an immigrant in New York and trouble accessing the healthcare system? If so, send us a video. And then those videos become, hard pieces of evidence and real power to show a legislator, like, look, this person is not getting the kind of care that they deserve. It's just some food for thought, and not everyone is on social media. Not everyone, that's the right route to go. But it is an effective place to kind of gain traction around causes that you care about. Join groups like Anna mentioned. Facebook has great groups. Follow hashtags of things that you think are important. There's a lot of collective action online. And one last thing before we kind of head to questions and answers is we want to show an example of how change happens. So earlier on, I showed you a slide where a bunch of people were being sued, right? And it's just like this trend that we saw. Well, we brought that up. We said, hey, as an organization, we're seeing that a lot of people are being sued, particularly from this one specific hospital, Northwell Health. We don't think that's right. We don't think charity hospitals should sue during a pandemic. It's not fair to consumers. People are already under financial stress. And just kind of speaking about the issue, using our voices, advocating for change, talking about social media, putting together research. Not everyone has the time to do that, but we're just kind of keeping that continual drumbeat going. We were able to enact real change. We ended up getting a front page of the New York Times. That's probably the loudest stories you can get these days. And with that, the author, Brian Rosenthal, of the article, with the power of his words, he was able to, put the story out here, and then Northwell, within hours, rescinded the lawsuits, saving 2,500, mostly low-income New Yorkers, about $4.5 million. And so, that's not going to happen every time. And we're, this is a power of an organization, but change happens when you use your voice.